If you've ever treated SIBO but had it come back, you are not alone. With relapse rates as high as 45%, it's no surprise that so many people feel like they're stuck in an endless cycle of bloating, discomfort, and frustration. But what if I told you that stopping SIBO for good isn't just about antibiotics or a restrictive diet? There's a hidden key that most people overlook. And today, I'm going to show you exactly how to break the cycle once and for all. Hey there, I'm Dr. Michael Arthur, otherwise known as the Mind Belly Doc, and in this video, I'll share the top reasons SIBO keeps coming back and, more importantly, how you can take control of your gut health for the long haul. Stick around because the last tip I share is an absolute game changer. Let's dive in. So, you've done the treatment. Maybe you've taken antibiotics, herbal antimicrobials, or made big dietary changes. But a few months after all of that hard work, boom, your symptoms creep back in. Why? Well, here are the top 5 reasons SIBO relapses. And trust me, these are things your doctor might not have told you, especially if you've seen someone that thinks SIBO is like any other infection in the body. One and done. You know, here's your one treatment round with an antibiotic. You'll feel all better in a couple of days. Good as new. Well, that works if you have a urinary tract infection, or usually works for a sinus infection where the imbalance is being caused by a bad guy. But in the case of SIBO, your overgrowth is from some of your good guys. So all bets are off when it comes to a one and done scenario. Reason number 1 for a recurrence of symptoms is that your gut's cleaning crew is on strike. Your gut has something called the Migrating Motor Complex, or MMC for short. Think of it like a house cleaning crew that sweeps bacteria out of your small intestine when you're not eating. But if the MMC isn't working properly, bacteria hang around, multiply, and hello, SIBO relapse. Reason number 2. Stress is wrecking your gut. Seriously. Ever notice that stress makes your stomach feel like it's tied up in knots? Well, that's because stress increases cortisol, which raises sympathetic tone and even lowers parasympathetic tone. Now, with a lower parasympathetic tone, or what we often call lower vagal tone, digestion is slowed or disturbed altogether, and gut motility is weakened. Combine this with cortisol's negative impact on your immune system, and voila, you have the perfect storm for SIBO to return. Reason number 3. Your diet might be working against you. Now, I see this one all the time, guys. Some people go too extreme with restrictive diets like the low FODMAP diet, which can usually starve out the good bacteria along with the bad bacteria. And remember, your gut needs some of these really good bacteria. Now, others will reintroduce foods too quickly, causing fermentation, and you guessed it, return of bacterial overgrowth. It truly is a delicate balance between not feeding your bacteria enough and overdoing it. Reason number 4. Hidden structural issues. If you've had abdominal surgeries, adhesions, or conditions like diverticulosis, these can create pockets in your intestines where bacteria love to hide. Scar tissue from previous surgeries can interfere with normal motility of the intestines, and just like a stagnant pond, things don't move around. but rather they get all murky and become the perfect breeding grounds for bacterial overgrowth. Reason number 5. Your gut didn't fully heal after treatment. Killing off bacteria is just step 1 of your treatment. Now, if your gut lining is damaged and your microbiome isn't properly balanced afterward, it's like leaving cracks in your foundation. The greatest majority of people with SIBO have some degree of intestinal permeability, or what we often call leaky gut syndrome. What was that? You don't think leaky gut is real? Your doctor said it was all made up by naturopaths and the like. Well, think again, friend. Search PubMed for intestinal permeability, and you'll get thousands of researched hits. If the integrity of the intestinal barrier is not restored, it is much easier for this to affect the immune system as well as digestion, and this becomes a perfect storm for SIBO to come crawling back into existence after a successful round of treatments. Now that we've covered the top reasons for SIBO to make a comeback, let's talk about how to fix this so that you're not stuck in the frustrating relapse cycle. Now, just as we had 5 common reasons for SIBO to recur, I like to think about 5 steps to ensure it doesn't. Step number 1, gut reconditioning. After treatment, your gut needs to rebuild and heal. And here's how. Use probiotics strategically. Probiotics like Saccharomyces boulardii and spore-based probiotics are great choices. We cover all of the choices and how and why to use specific ones in our online program called the Mind Belly Blueprint. Now, in addition to the right probiotics and prebiotics, you will additionally need to support the healing of your gut lining with things like L-glutamine, zinc, and vitamin A to repair any damage. These are just a few of the common nutrients used to help heal the gut lining, but there are certainly more options, and we cover those in the Mind Belly Blueprint as well. Step number 2. Keep your MMC moving with ProKinetics. If your gut's cleaning crew, or the MMC, isn't doing its job, we need to get it back to work. ProKinetics like ginger, iberogast, or low-dose erythromycin can help keep bacteria from building up again. Stick with them for at least 3 months or longer after you have finished antimicrobial treatment. Some patients with really resistant cases need more than one prokinetic to get the job done, or may need stronger prokinetics like Motegrity to get the job done. Step number 3, manage stress. Your gut will thank you. You don't have to meditate for hours, but even just 5 minutes a day can make a massive difference. Simple stress management techniques actually impact your gut health in a variety of beneficial ways. Think about deep breathing exercises, a quick hypnotherapy recording, or a tapping session. No, not tap dancing, but rather EFT, or Emotional Freedom Technique. I'll have to do a future video to demonstrate EFT, but think of what would happen if active meditation had a baby with acupressure. And there you have it, EFT. So while we're talking about managing stress, remember, you're less resilient to stress if you aren't prioritizing quality sleep. You need your sleep, and most adults need 7 to 9 hours. So stop the late night scrolling and get to bed. Step number 4, be smart with your diet. The goal isn't to stay on a restricted diet forever. Start with a low fermentation diet during treatment and then slowly reintroduce diverse foods. You do not have to wait until all of your antimicrobial treatments are done in order to start reintroducing foods. Usually, waiting too long is more detrimental than jumping the gun and starting too early. So you'll know if you're pushing it with too much food too soon. Your body will give you the feedback through bloating, gas, and belching. Also, and listen closely, my friends, now to what I'm about to say. It's not always about what you're eating either. There's a lot to be said about the when of eating. You have to give your gut time to rest, avoid snacking, and leave 4 to 5 hours between meals to let the MMC work properly. Step number 5, address the root cause. If you're doing everything right, but still relapsing, it's time to dig deeper. Work with a specialist to check for adhesions or scar tissue, hormonal imbalances like hypothyroidism, and ileocecal valve dysfunction. If you take one thing away from this video, let it be this: SIBO relapse isn't just bad luck, it's a sign that your gut needs extra support. So, by focusing on gut reconditioning, keeping the MMC active, managing stress, smart dietary transitions, and treating the root cause, you can finally break the cycle and keep your gut healthy long term. Now, if this video helped you, please let me know in the comments. I always love hearing from you all, and most importantly, I love hearing what you want to hear next. Seriously, there have been a couple of videos now that we've produced that wouldn't have been produced without your questions and your ideas. So keep them coming. And don't forget that all health, good or bad, begins in the gut. Until next time, be well.